The content of this interview is provided for information and education purposes only. You should consult your physician for advice on treatment, including supplements. Supplements may interact with other medicines and other health conditions. So please check with your doctor first.
Welcome back to our interview series on B1. Daphne, good morning and thank you very much for being with us today.
Buongiorno, Sergio. Good morning, everybody.
Good morning again. So, Daphne, monitoring symptoms is crucial while searching for the right dose of B1. How can a person with Parkinson keep track of their symptoms?
Well, first, it's a good idea to make a record of how your symptoms are before you start the therapy. You might make a video of you walking, talking, writing, etc. In fact, anything which you currently have difficulty with. You could also complete the online rating scale known as the UPDRS. There's a link for it in the book. Once you've started B1, a daily diary is essential. This could involve simply writing about symptoms as they occur each day, or you could make a full list of all your symptoms and give each item a rating score each day. Then there are things you could check weekly, like the online UPDRS. It's quite an extensive list and might mention symptoms which affect you but which you had not thought to monitor. Something else to check weekly is the pull test, which Dr. Costantini always checked when he saw his patients. You could also do weekly samples of handwriting. Do it at the same time of day, preferably just before medication. Set a timer and write for at least 3 minutes each time. Finally, enlist the help of other people. Often your friends notice more than you do yourself.
Right, now we have a question from a member of the Facebook group. Susan McDonald Stewardvan asks, why is it that if taking too much B1, some symptoms get better, like fatigue, yet other symptoms get worse, like tremors? These are just examples.
I would query whether any symptoms are actually better in an overdose situation. Sometimes when you've taken too high a dose, it can feel as if you have less fatigue, but the energy can often feel quite manic. You want to have more energy, but you don't want to feel wound up. Overdose symptoms are hugely variable from person to person. They could be symptoms you had before starting B1, which get worse, or they could be new symptoms. But basically, if it's an unwanted symptom, it could signify overdose.
Now, if there is such a variety of symptoms, how can you be sure that worsening of some symptoms is caused by too much B1?
Well, we've all done it, explained that our worsening symptoms are because our Parkinson's getting worse. After all, the medical profession has told us they will get worse. However, if you do find yourself thinking this way, first stop and do the overdose test. That is, take a break from B1 for 1 to 2 weeks. If you find that the unwanted symptom goes away, then you will know that that symptom was caused by too high a B1 dose.
Now a question on RBD. RBD means REM sleeping behavior disorder. RBD is when you act your dreams. You may shout, kick, punch, or even hit your partners unintentionally, or jumping off the bed while sleeping. It is a very common condition in Parkinson's disease. About 33 to 50% of people are affected. It is a condition on its own rather than a symptom. RBD may precede Parkinson's by many years, like loss of smell, constipation, depression. Now, RBD has been associated with cognitive impairment in the long run, so it is an important condition to take in mind. Can it get any better with B1 therapy?
Well, it possibly can, although very few people have mentioned improvement in RBD symptoms, but only a few have reported the problem in the first place.
Dr. Costantini mentioned that based on his large experience with thousands of patients in Italy and abroad, all persons with Parkinson's would respond to B1 therapy to a certain degree. Some persons with Parkinson who have tried B1 therapy on their own report on the Facebook group that they got no benefits from B1. What do you think are the possible causes for not responding to B1?
Well, there are several misunderstandings about the therapy which can lead to failure. One of the biggest confusions is thinking that a very high B1 dose is needed for the therapy to work. And instead of searching for the dose which makes them feel better, some people just aim for a particular high dose, believing that it must be very high to be therapeutic. This is wrong and frequently causes overdose symptoms. Other misunderstandings include only trying one dose and giving up when it doesn't improve symptoms, trialing each dose for too short a time and increasing the dose before symptoms have been given a chance to improve, not taking a long enough break for thiamine levels to drop after an overdose before starting again, not monitoring symptoms carefully enough and totally missing subtle improvements which signify that the right dose has been found, not holding the dissolved sublingual tablet in the mouth long enough to allow it to pass through into the bloodstream. Swallowing the saliva too soon will mean that most of the B1 gets lost in the digestion. Increasing the dosage after improvements have been seen, thinking that more B1 will produce more improvements, when all it does is produce overdose problems. Often people with Parkinson's have an inefficient gastrointestinal system, which can reduce the effectiveness of oral thiamine. Sublingual tablets or injections might be a better choice for these people. And finally, people can sometimes be deficient in the other nutrients which support the B1 therapy, particularly B complex and magnesium, without which the therapy might not work. Any one of these situations can lead to a person thinking that B1 isn't working for them, when it's often more a question of their not understanding the protocol.
Now, we've talked about overdose symptoms. It is generally acknowledged by drug regulating authorities and in-depth reviews that thiamine B1 is overall well tolerated even at high doses. However, Facebook group members from time to time report side effects and ask whether these can be due to B1. Which side effects have been reported? Is there a difference in occurrence of side effects if you take oral or intramuscular B1?
Various national scientific committees have concluded that thiamine appears to be safe and well tolerated, even at high doses. Ingested thiamine in particular has a very low toxicity in humans. There have been a few case reports of side effects at very high oral doses of thiamine hydrochloride, 5,000 to 7,000 milligrams, for example. But when B1 was stopped or the dose reduced, these symptoms disappeared. Side effects associated with lower doses, such as an allergic sensitivity causing an itchy skin, have been rare and mostly reported in patients who had received repeated vitamin B1 by injection. More serious allergic reactions to thiamine, such as anaphylactic reaction, is very rare and occurs mostly with injected B1, particularly intravenous injections. These reactions occur within 24 hours of receiving the thiamine, and if identified and treated immediately, they resolve.
So you have mentioned about the importance of magnesium in B1 therapy. Thiamine needs magnesium to be activated in the cell, and many thiamine-dependent enzymatic processes are also magnesium-dependent. How important is to take magnesium supplements in B1 therapy?
Magnesium is an integral part of B1 therapy for the reasons you've just stated, and also because many people with Parkinson's have magnesium deficiency, and this might make them less likely to respond to B1.
And when should magnesium be taken? Before starting B1 or after finding the right dose?
Well, we don't recommend that magnesium is started at the same time as B1. You're trying to find the B1 dose which improves symptoms, as this will signify your correct B1 dose. Because magnesium might also improve symptoms, starting both B1 and magnesium at the same time might confuse your trialing. So if you haven't begun B1, it's a good opportunity to get magnesium and B complex established for 2 to 4 weeks before starting it. If, however, you've already started taking B1, then wait until you have found your correct dose before starting them.
Thank you very much again, Daphne. And please don't leave. In a few moments, you will be watching an exceptional video showing better than 1,000 words what effects B1 therapy may have on a special performance. Keep watching and bye-bye from us.
Daphne got her Parkinson's diagnosis in 2010. She recalls how it all started.
I realised something was wrong when my right hand wouldn't move quickly enough when I played the piano. I'd been asked to demonstrate a new piano to a large group of people. As I sat at the piano, I noticed that my right hand was shaking, just my right hand. I started to play, but my right hand wouldn't keep up with my left. I panicked. What was happening? I was diagnosed with Parkinson's soon after, and over the next 7 years, increasing rigidity and bradykinesia made playing the piano impossible.